There is always a need for some new drugs, the treatment for this tuberculosis basically. It's been almost 4 decades now that we are just working on that, and still no such new things have come up, except this bedaquiline, which is still has got some priority in the drug trials. Right, so first of all, there is always a variety of tuberculosis where we always need some new drugs, like the multi drug resistant tuberculosis. Basically, it arises just because of the overuse of antibiotics or by the defaults in some treatments. Like patient sometimes he misses some of the drugs in between, and then with the subsequent course, whenever he takes it again and again, then it develops some of the resistance. The bacteria become resistant, and we always require some new drugs to work on that, so that we can just eradicate that. Second thing, we can just think of the new drug just to avoid any such side effects. There are so many side effects. All those patients who come to us, most of them say that they cannot assimilate the medicines well. Either they are having some of the symptoms like nausea is there, vomiting tendencies like always they feel. First of all, if we check with the few of the things, then sometimes we find that the liver functions have got deranged, and the digestive system is getting uh, affected with that. So in all these categories, definitely we require some of the drugs which are more gentle on the human being. They are something like which are more rapid, and which are having less cumbersome job in that. So that's why, just to avoid all these side effects, there is always a need for some new drugs in the treatment for tuberculosis. Next, if we think of, like we say, the point number 3 are the relapses. In most of the cases, we have seen that patients come, he has taken the treatment for 9 months or 6 months or 7 months depending on the case, and after a few months or say few years, maybe under some bad circumstances, he again develops some of the tuberculosis symptoms. Then the doctor says, okay, you have to take it again, and then again it's a moral trauma for the patients that how we take this, and this is again going to take so much time and everything. So there has to be some drugs now which are which we can just stamp on them that definitely they can eradicate, and their chances of relapses are almost negligible. Though we cannot say okay, it is almost gone, but the chances of relapses will be negligible. Next, the continuity or the regimen of these medicines in itself is a big task for the patient. When you say that you have to take 4 drugs or 6 drugs at a stretch, one in the morning, then this time, then this time, then this time, then it's like a full day project for the patient. Sometimes they are not able to abide all these rules, and that is why they miss all these things. And then again, chances of relapses and converting it to the drug resistant tuberculosis is almost very high. So we need to just rule out few of the regimen where we can just give only 1 shot or 2 shot a day, and the patient gets fine with that only, and that we can just continue for some time. That will be another thing. So definitely, to avoid these relapses and to get our India almost this tuberculosis free, we need to make out some of the faster medicines where the relapses are less, and the chances of defaulting the medicine treatment is always less in that case. Next, to eradicate, of course, these all are the, like I just talked. Okay, there are medicines which always work on the thing. We start with the antibiotics. The drug load, the bacteria load has gone down, but suddenly again the patient starts feeling sometimes not very comfortable. So just to eradicate it completely, there is always a need for some new drugs, again, which can just put them at bay. Second, or the next thing we can think of, all those patients, those who are into some special category, like we say, if the pregnant ladies sometimes are not able, for the geriatric patients, the old age patients, they always feel it very much problematic that how to just digest all those remedies. Even the kids, it's always very difficult to make them follow those certain rules and to take 4 6 drugs at a time. So this is always a problem in this treatment for tuberculosis, where we always look forward to get some more rapid and gentle medicines which can work on all these categories. Like, just important to mention here is the thing, all those immunocompromised patients having this, suppose the HIV, if a person is having AIDS and he is already taking so many drugs for the HIV, and the immune response has got so down that he cannot just tolerate them well, then it is always a question that which drug to select and which not to select. That is again a problem for this uh, total thing for this normal traditional methods we are following and the modern medicine we are following for the tuberculosis. So there is always a sphere, there is always a place where we can just explore more about all these drug resistant tuberculosis and all these patients. We can think of some new medicines, of course. So there, according to me, there is always a need for these new drugs, right? Okay.